Joining me right now is Dr. Jay Wolfson, a professor at USF and Stetson. We've had him on the air quite a bit talking about medical issues and issues of public policy. So we're talking about the president's proposal that he would like to see drug testing, or at least give the states the option of drug testing. And the first question is, haven't we heard this before?
Yes, Al, we have heard this before, in Florida in particular, dating back to 2013, 2014, and we've heard it across the country before, in an effort to either reduce costs for welfare programs or to ostensibly create a more direct link between the social goal of transitioning people from welfare to work and the state's interest in making sure that they are paying for things that have value.
So the question is, could this thing be challenged legally again in the state of Florida? And again, remember, this would just simply give states the option. They wouldn't necessarily have to do it, but could this be challenged all over again?
Yes, it likely will be challenged all over again in other states that have attempted to do pieces of things like this. It has been challenged, and that will prolong the possible implementation by months or perhaps years.
There is the suggestion, even by having this law, and it's a stereotype. It's assuming that somehow, if you're on welfare, you're going to be doing drugs. And I'm not sure people think that that's a fair comparison, period.
Well, not only is it perhaps not a fair comparison, but it's not scientifically demonstrated at all. I mean, there are people in all parts of our society who will test positive for drugs, and welfare recipients in various tests that have been done in studies, sometimes they test a little bit higher, sometimes they test a lot lower. And the stigma of drug use alone is likely not a constitutional basis for imposing an exception to the Fourth Amendment right to be free of unlawful searches and seizures, which is exactly what our Florida courts determined back in 2014, and other courts have as well, including the Supreme Court, by the way.
Yeah, and so one of the reasons the proposal is being made, if you read the fine print, is that the White House is trying to cut funding for the SNAP program. By the way, that's what it's called now instead of food stamps. That's the State Nutritional Assistance Program. They're trying to cut costs by some $200 billion over 10 years. I mean, that could really devastate an awful lot of people in this country, couldn't it?
Well, it would have a dramatic effect on a lot of people's access to getting essential nutritional foods for themselves and their family members over the long term, but there's no scientific nor historical evidence that by doing that you're going to push those people into the workplace where they will become self-sufficient individuals in our community. It's essentially a two-pronged approach by the current administration, and that is to cut funds and in some respects to punish people who have not been able to get a job to sustain themselves.
And why do you think in general that food stamps as an issue for some is controversial?
I think for some they see it as a handout, and there has been fraud and abuse in the food stamp system, Al. In some communities, food stamps are still traded on a black market as if they were cash, and then the money is used for illicit purposes. But for the greater part, the goal needs to be, and it needs to be enforced, that it's to provide nutritional supplementation and sustenance for families who are unfortunate enough to have fallen into that safety net that we as citizens believe is part of the role of government in our communities.
Yeah, and
there's always going to be deviation from that.
Yeah, I mean, nobody wants to be on food stamps, do they? No.
I don't think people want to be on food stamps any more than they want to be on welfare. I mean, some people may, but I think that's a very small portion based on the data we have. This is a true safety net program in our communities. And you know, the most important factor is that it's children and adolescents in these families who really benefit substantially from the proper use of food stamps in their households.
Now, this goes back to one of the questions I was going to ask you early on. Is there any data that suggests that if you drug test, number one, it would end up saving money in the long run, and number two, that would improve the prospects of those individuals that are trying to find jobs?
There are no good data to indicate that you're going to save money. In fact, the data we do have is that you're going to wind up spending a lot of money. You have to activate resources, hire people, have a whole bureaucratic mechanism in place, a record-keeping system, a follow-through system to perform those things. If you're going to have people pay for it themselves, that creates another bureaucratic mechanism. in the efforts that have been done, it costs more to do it than you get out of it. And the data on the efficacy of people who are tested going into the job market, it's pretty much a wash. There's no indication that those individuals are more successful in going into the job market and transitioning from welfare to work.
Now, the Trump administration will likely say, because this is optional, and those that are proposing this, is that states can go ahead and say no. So in one way, the federal government would like to see it enacted, but in another way, they can't force people to enact it.
Well, enacting it is one thing, and then operationalizing it is something else. It's like the federal government saying, you know, we'd like there to be a 55-mile-an-hour speed limit across the United States, and they tried doing that at one point in time. And the enforcement arm they had was using Department of Transportation roads monies and said, well, if you don't do that, we're going to cut back on those federal monies. At this point, from what I've heard, the administration is not proposing that if you don't agree to do it, that there will be some financial recourse that will adversely affect the state.
Dr. Wolfson, you've watched this for many, many years. Does it still surprise you that in this land of milk and honey, as they oftentimes say, that we have so many people that still desperately need food assistance?
It shocks me all the time, Al, especially when I'm driving through some of our inner city urban neighborhoods and some of our remote rural neighborhoods where we have what we call food deserts, where people don't really have access to good food, if any food at all, because there aren't any supermarkets. There are very small stores that sell a lot of foods that are not nutritious. After the recession, there are so many people who have not been able to retool and get jobs. And it's a balancing act, Al, that you and I have talked about in the past, and that is the importance of having individual responsibility and people taking initiatives in their own lives to self-actualize and take jobs and take care of their families, and the role of the government and our communities to say, well, if you fall through the cracks, the weakest link in the chain affects each one of us, and we have an obligation to help people at least sustain themselves, but how far do we boost them up without becoming a welfare state where people take these things for granted? And I think that's the big discussion that's going on in America right now, and we are divided right down the middle of that, culturally and politically.
And have the requirements for the people that are eligible Go ahead. Go ahead, Doctor.
I'm sorry. One thing I think that I think that the listeners should do, and you know, read the Constitution. Read Thomas Jefferson, and remember that these components of the Constitution that protect us from things like search and seizure overreaching and free speech overreaching are designed to protect us from a government that we had once when England was trying to rule us. And Thomas Jefferson said we have to be constantly vigilant to protect ourselves against those things. And if we're not, then we run the risk of having government systems that impose upon us and take away our basic rights. But it's a very delicate balance and a social justification, saying we think that if people are on welfare, they should go into work, and that if they're on drugs, it's a bad thing. That's not a sufficient enough justification constitutionally, Al, to invoke a legal exception to the Fourth Amendment.
Dr. Wolfson, thank you. Your comments are always so on target. We appreciate your time.